Bismillahirrahmanirrahim. Assalamu alaikum students. Today we will be very briefly discussing systemic manifestations of inflammatory process. Or in other words, we can say we are going to discuss systemic or involvement of different systems of the body as a result of infection in the human body. Students, the systemic manifestations of inflammation or infection are called acute phase response or systemic inflammatory response syndrome, SIRS. Kindly give this mobile camera to me so that I may have a closer look of the written material. Students, please take a careful look. Systemic effects of inflammation. Systemic manifestations of inflammation or infection are called acute phase response or systemic inflammatory response syndrome, SIRS. What are those manifestations, students? Number one, most important, fever. Fever is characterized by an elevation of core body temperature by 1 to 4 degrees centigrade. Students, as a result of fever or inflammatory process, leukocytes are activated, which release interleukin 1 and tumor necrosing factor alpha that increases the enzyme cyclooxygenases. Students, this enzyme cyclooxygenases, it converts arachidonic acids into prostaglandins. So we can say that prostaglandins are main responsible for fever, especially prostaglandin E2. Now students, acute phase proteins. What are acute phase proteins? These are the plasma proteins synthesized in the liver in response to inflammatory process. Students, there are three different types of acute phase proteins: C-reactive proteins, fibrinogen, and serum amyloid A proteins. Students, in acute inflammatory process, these three acute phase proteins are raised in their blood levels. Leukocytosis means increased number of WBCs in the blood. Students, this is a hallmark of inflammatory process or infective process. What happens? Neutrophilia. Neutrophilia means increased number of neutrophils. It happens in bacterial infections. Next, we have lymphocytosis. It means increased number of lymphocytes in the blood. Students, it mostly occurs in viral infections. Then we have leukopenia. Students, leukopenia means decreased number of WBCs. This phenomena is mainly seen during typhoid fever and some of the viral infections. Now students, we have eosinophilia. Eosinophilia means increased number of eosinophils. Students, eosinophilia is mainly observed during parasitic infestations. Other systemic manifestations of inflammatory process are increased pulse rate, increased blood pressure, rigors and chills, feeling of cold associated with body shakes and chills. disseminated intravascular coagulation, which is also called DIC, and at the end we have got thrombosis. So, students, this was a very brief review on systemic manifestations of acute inflammation or infection. Thank you, students. Allah Hafiz.